Hi, everybody. Good morning and good afternoon, wherever you happen to be. Welcome to City Talk. I'm Mary Rowe at the Canadian Urban Institute. Today, I am in an extraordinary place, Rocky Harbour, Newfoundland, which is the traditional territories of the Mi'kmaq and the Beothuk, and has a long relationship with being an unceded traditional territory of First Nations that are actually no longer resident here. And that's a whole set of challenges upon itself. We would ask everybody to sign in across the country and tell us where you're coming in from and what your particular attachment is to the ancestral territory from which you come. These conversations, as we know, take place with people from all across coast to coast to coast. They're intended as candid conversations about what's working, what's not, and what's next for Canadian cities. And we're really happy to have you here for what is a really profound and important and compelling challenge and topic, which is the future of our downtowns and main streets and how they're being affected by what is a mental health crisis. I just got off a call earlier today with city managers across the country who were continuing to describe what they see as a mental health crisis. So we feel fortunate to have such a great group of practitioners and people providing different perspectives on what they're actually seeing on their, right, as we always say, what are you seeing right outside your front door? What are you seeing on the street? And the adage we always use is what's working, what's not, and what's next in terms of addressing mental health. Many of you know that CUI has stayed focused on downtowns and main streets as our two primary lenses of how our cities are doing. We've come out a couple of weeks ago with a report on the potential for conversion of commercial buildings into residential buildings and other uses, and how are we going to readapt and reimagine our spaces. But obviously, one of the key challenges is what is actually present now if we don't have a lot of workers or as many workers coming into downtown commercial areas. What is happening in the downtowns and what's happening on our main streets? And all you have to do is read the papers to know that we've got a significantly visible, visceral challenge of people needing supports, mental health supports, interventions, and supportive housing. I also just want to put a shout out that we have a big chunk of the country disproportionately continuing to fight fires in May. In this part where I am, I flew over the fires that were happening in Halifax. We know that the West, Alberta, and almost all of Alberta and part of BC were clouded in smoke for the last 3 weeks. So this is a remarkable moment for us to just be in solidarity with each other as we try to continue to think about how we make our communities more resilient economically, environmentally, socially, and obviously to the kinds of challenges that our communities that are dealing with fires are on. So encourage you to use the chat. Those of you that are new to City Talk need to know that if you haven't ever gone onto the chat, you should, because there's a whole parallel universe. I'm watching it right this minute, popping up, people saying where they're coming in from. And through the hour that we're going to spend together, people raise issues here, they ask questions, and lots of conversation goes on in parallel, because City Talk audience is a multitasking one who can listen to this panel and have a conversation there. And everything that you put in the chat, we publish and we keep. So if you're putting resources in there about new leads that people could follow about mental health interventions that are working, please put them there. And we would encourage those of you that have never actually participated in the chat, give it a try, participate, because it's a really interesting way for us to continue to share knowledge with each other. So I'm going to invite our panelists to put their cameras on, and we've got quite a few this time. As you know, we try to sometimes keep it a bit smaller, but this topic was just so pressing for us that we felt we wanted to get a broad range of perspective. And this is a very difficult topic. And I just want to say to the City Talk producers, thank you for whatever that beautiful music was that you put on at the beginning, because that really set a kind of tone about how to have a serious conversation in a respectful and gentle way. And so that's what we're going to do. And so I'm going to start, if I can. Usually it's pretty random how I choose for people to go, but we're going to go west to east. Because I'm at the far east, and ask each of the contributors to just give us for a couple of minutes their perspective about what they're seeing. What do they see as the particular challenges around mental health provision and services, and what are the challenges you're facing? And we'll do that around the country, and then we'll come back and have a group conversation. So I'm going to start, if I can, with Superintendent Howard Tran, who is in Vancouver in the police department. Over to you. And as I said, we're going to drop titles once I've just done the introduction. A full bio appears in the chat, guys, if you want to see exactly what Howard's about. But Howard will go first and just tell us a bit of what he's actually seeing. So welcome everybody to City Talk. Howard, off to you.
Thank you, Mary. I want to start off. Good morning, everyone. I want to start off by acknowledging that I'm speaking to you from the traditional and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh First Nations people. Yeah, very happy to be here. What are we seeing on the ground? I think I've been doing this work for a number of years, and the challenges that we've identified 20 years ago remain the challenges that we're talking about today. And these are sort of lack of mental health beds, lack of services, lack of coordinations. We have what we call silos of excellence, but system failure. We've replaced basically our prisons, our mental institutions with prisons. Basically, the four walls have just changed, but the folks that are within these places are still the ones that are sort of the most marginalized, most vulnerable, the ones that are suffering the most from mental health issues and substance use issues. So I think Vancouver, of course, is been front and center in many of these issues. We obviously have the fentanyl crisis going on right now. We have the encampments in Vancouver. And so the issues that we're facing are really sort of, I think, seen across the country, but really, for us, it's really concentrated in a particular area, and we're really trying to dig our way out. And, I think if I had to sort of sum up, we just need more services and more all the service providers and all the community groups and all the institutions to get together and really be coordinated on what we're delivering here. So I'm sure there'll be more questions to come, and I'll just leave it at that.
It's interesting what you're pointing out. We've been doing a lot of these sessions on housing and homelessness, and everybody points to that moment. I'm going to skip and go a little bit not as methodically through the country, because I'm going to go to Andrew Bond next. Al, I haven't forgotten about you, but I'm just going to go to Toronto next, only because of this, that this moment where we made some public policy decisions around deinstitutionalization, which is several decades ago, but it has had these extraordinary implications in terms of how that decision, public policy decision, was made without the supports being in place. I guess that's the dilemma. And so what you're saying is, I can see it on the streets. Andrew Bond, will go to you next, and then Al, I'm going to come back to Winnipeg. Won't forget you. So Andrew in Toronto, go ahead, Andrew.
Thanks so much, Mary and Howard, for that framing. I think it's really critical. I think it really gets at the pressure points that we're all feeling, I suspect, right across the country at ground level. We know that we're at some version of boiling point, however you want to characterize it, where the needs and demands are just so deeply mismatched right now. But this takes place, to your point, Mary, on a backdrop of a bit of a historical trajectory here. I think it is important to really also do the contemporary piece of the framing, where we know that with the economic challenges and instability of the last few years and the impact on housing markets and affordability, that those two dimensions of larger macroeconomic and macrostructural policy changes and environments are interacting with this historical trajectory of not having the degree of intensive support in the community that were always needed to actually successfully transition from an institutional approach to mental health care into the community. And so now we are seeing what is ultimately about a 35 to 40-year-old trajectory coming together at this point, that where the healthcare systems are at our weakest, because we've just been through 3 of the most grueling years and resource depleted, we know, and also even more so than that, personnel depleted just through the wear and tear. And so now we have all of us trying to do our best at the hardest time to be able to actually support. And so we know, to your point, from that transition from the institutional to community setting, that the only way to successfully make a transition like that is to deepen and intensify the supports available in the community. And these are certainly not cheap, but they are cheaper and more effective than can happen in institutional environments. But we have not done that. We've taken the approach of both doing it as lightly and cost efficiently as possible, but not effectively, and not doing it to the point that Howard's raised with the degree of coordination that might happen in an institutional environment. So institutional environments do provide closed systems for the most part for highly coordinated and integrated care. That same functionality has to exist in the community, and we don't have that. We've never invested in that. And so there are those of us who are working very hard to try to develop that right now. But if we're going to be able to get through this, we do have to actually see the investment and build on the strengths that have been built up through the pandemic period. So I think I'm hopeful that we can get there, but we need a combination of policy support, no question the funding support to this. There's no way to make it through this without it. And the on-the-ground engagement and coordination that Howard's speaking to, that has to come from both a public and private sector partnerships together in neighborhoods and communities.
It's interesting the point you just made about, you know, the old adage, one-stop shop, you know, the idea that if you're in an institutional setting, the belief is, oh, we can coordinate things because the 4th floor is talking to the 7th floor and we'll just do it. But we do know that fails too. So even when you're in the same institution, you know, just saying. So but I hear you that dilemma then is that when you disperse into the community and you've got so many delivery agents, or maybe you don't have enough delivery agents, how do you actually create that community piece? So policy support, funding support, and then this on the ground coordinating support. And how we're going to get at that. Okay, Al, now to you in the center of the universe.
Yes.
Winnipeg.
Well, you know, with our current government, we've seen massive cuts to the healthcare system, and that is truly affecting what folks can do with the mental health issue on our streets. And it's a real shame that that's happening. We are, you know, we've seen, again, due to the pandemic and other measures, we're seeing middle-class people drop into poverty, beneath the poverty line. We're seeing people beneath the poverty line drop into homelessness, and those numbers are increasing. And one of the things that's, you know, it shows everybody that, well, it's become way more visible. You're seeing people in the bus shelters. We're seeing people in tents everywhere. They're expanding, and there's an outcry about that. But you know, our point in time counts show that you know, one of the biggest reasons for homelessness is certainly mental health issues, and families and relations not knowing how to deal with it. People end up on the street, and you know, we've had this long argument about putting healthcare professionals with the police, and there's this big defunding the police thing, which I don't believe in, but we have to add to the police budget to put healthcare professionals with the police to deal with the homeless factions. And what has happened on our streets, and I'm really happy to say this, that organization like Main Street Project, the big shelter here in Winnipeg, is sending out you know, people with mental health acuity to work with folks on the street. They'll have three-member teams in their outreach vans, and working with folks, because it's such an issue. And it's, you know, not only the homeless though, but it's the people, newly impoverished folks, or newly that are not dealing with the trauma of today's society, and dealing with the trauma of not being able to pay the bills and not being able to feed their kids. And we're seeing a lot more violence from that, or you know, things like broken windows in downtown that like never before. And you know, also, you know, with the rise in cheap drugs on the streets, the psychosis goes up, and we're seeing a lot of that as well. So right now, I'm not seeing a great deal of progress in dealing with the mental health issue in downtown Winnipeg. But you know, thank goodness that our organizations are working towards, you know, that end, whereas the city and the province hasn't really made a great deal of have progress in that regard.
It's interesting, Al, what you described, because I was doing an interview earlier this week with a mid-sized city, and who was talking about vacant storefronts.
Yes.
And as you say, it's like a cascading effect, right?
Yes, it is.
This is if anybody's on the call from London, Ontario, chime in and show us that you're on the chat. But London's challenged because it has empty storefronts, vacant storefronts, and parking lots. And so, as you suggest, and then if you add on to that cheaper drugs, higher contamination rate, or whatever the right word is for drugs, and then a lot of supports. And I want to come back to the point you mentioned about who should be delivering services, these kinds of outreach services to people. Where is it right to situate those resources? I'll come back to you on that, Al. Thank you.
Thank you.
Let's go now to the north part of Ontario, to Kyle Marcus, who's in Sudbury. Go ahead, Kyle.
Hi, Mary. I'm super grateful to be here today and a little overwhelmed to be sitting with such a great group of panelists. I come from a unique perspective. I am the managing director of a downtown BIA. So I represent about 450 businesses and about 100 property owners, of which I also have a business within our membership. So I actually have two front doors to look out of for perspective, and both of them kind of see the same thing. All day, every day, I just see people trying their hardest. I see our vulnerable populations trying to navigate what I would describe as an inhumane and unkind landscape. Whether that's the stigma attached to poverty and addiction and mental crisis or mental health, or lack of housing or anything like that. We see them trying to navigate this landscape, especially when there's not enough supports or services. And on the flip side of that, I see businesses, people just like me, trying to feed their families, follow their dreams, contribute back to the community we love, while we see these social issues seemingly continuing to consume our neighborhoods. And all of this happens, under the guise of almost finger pointing. It feels like nobody's rushing to help. Other areas of cities, point to the downtown like we invented addiction or homelessness or mental crisis, and we forget other parts of cities that aren't in downtown seem to forget that these are our uncles, our aunts, our neighbors, our cousins, and loved ones, and that eventually it becomes all our responsibility to take care of these people. And it's not until it seemingly spreads outside of downtowns to these suburban areas that we start to see solutions. So it's been an interesting place to stand. I don't say between businesses and vulnerable populations, but with them both, and trying to find workable, feasible solutions for everyone that bring human dignity back to people that have had it removed, as well as the ability to feed your family and pursue the avenue in which you'd like to make economic difference.
It's interesting, Kyle, the point you make about when does it touch us personally. I would have thought there's not a person on this panel or in this gathering of several hundred people that are on this call that aren't either experiencing themselves some degree of mental health challenge or have someone in their family who is, particularly through the pandemic. So I don't know how we all cut ourselves some slack here. We got to build more empathy for each other, because we're, as you suggest, it's your sister, it's your brother, it's your cousin, it's your colleague, whatever it is. And then the question then is, how do we create these, I appreciated your language, that we've got inhuman landscapes. You had a second word, which I've forgotten what it was, brutal maybe, but
Unkind.
Unkind. Thank you, unkind. So how do we get where it's really about how are we going to reinstitutionalize kindness? It's more than that, obviously. Okay, Mayor Guthrie, let's go to you in Guelph, and then we'll give Suzanne a chance to.
Thanks, Mary. Thanks, everyone who's spoken so far. You'll probably see some common threads here amongst everything that we're seeing on the ground. And so in my 2 minutes about what am I seeing, I'm seeing a complete failure of our healthcare systems. That's really what it comes down to for me. It is very difficult for people that are in these vulnerable positions to be able to navigate through the system. There is, I would feel, a lack of coordination between the system as it is. And so what's happening is, especially from a municipality lens, is that cities are having to step into the healthcare sort of arena. And municipalities were never set up for that. We never were set up for financially dealing with this issue. We were never set up from a staffing capacity side to deal with this issue. But it has become so in our face that we have not been able to ignore it anymore. Just to give some perspective, I was the chair of the Ontario Big City Mayors Caucus for a few years, and last year the caucus, which represented 29 cities in Ontario, which was 70% of the population of Ontario, we passed a motion unanimously asking for an emergency meeting with the province on this very issue. Especially because we were seeing it play out in our downtown cores. And we were very worrisome for the people that are struggling. That should be our main focus and concern, of course. But for the businesses in the area, they're just coming out of COVID after a couple of years of barely holding on. They're trying to keep their businesses alive and thriving and their employees still hired. And instead, they're shifting from trying to focus on creating a great public space and a great welcoming space for tourism and for economic development. And instead, they're shifting even themselves into the social services realm. And so we needed to try to elevate this to upper levels of government, and we still continue to do that. And it's very difficult conversations that I'm having to have. I've been the mayor for almost 9 years. I never, ever thought that I would be probably dealing with 2 or 3 issues a day on these topics, whereas 8 years ago, it was hardly at all. So there's a system failure here, and everyone's heart is in the right place. But it's something that's so dearly needed, and I'm seeing it and hearing about it all the time. So I hope that this conversation and others and those that listen after this really try to figure out some ways we can work together with those upper levels of government that I believe really have a duty and a jurisdictional place to be helping with this issue a lot more than they are.
Mm-hmm. It's always interesting to hear, and we hear it frequently, that just Kyle was echoing in many ways what you're saying, Cam. And all of a sudden, people that work for BIAs are social workers, and all of a sudden, people in the permitting office have to do referrals to mental health supports if they have supports that they can find or refer to. So it's as if we've all had to do the pivot to becoming sort of stewards. And I think this is part of what Al was getting at too, is that, and Al has his own experience of this, about when you're in a vulnerable situation and you need help, sometimes the provider of the help isn't the one who thought they would be. I'm appreciative people are checking in from libraries, including I see Luke from the London Library. And you know, libraries are now on the front lines of providing these social services. They're becoming like the new emergency rooms, I guess. So this is part of the shakedown that's going on. And how are we going to cope with it? You know, because I worry that we can wring our hands, we can say, no, I won't do it. But the truth of it is we're all having to do it, you know, and then how do we realign resources? How do we make sure that the people that are being expected to provide this kind of service actually are equipped and resourced to do it in ways that are positive and not harmful? So, okay, Dr. Suzanne Shoush is joining us. Over to you, Suzanne. Welcome to City Talk. Really, really glad to have you part of the conversation. Go ahead.
Hi, thank you so much. So I'm Dr. Suzanne Shoush. I'm here in Toronto. I'm personally First Nations through my mother, who's Lillibut Coast Salish, and my father is from the Sudan. Interesting when we talk about this conversation, and it's really important to take a few steps back. I know that the beginning of the conversation started around the challenges that we're seeing in mental health. And when it comes, you know, to our cities and our streets and the reality that this is a public health crisis, this is something that is just as relevant to our community and our public health as COVID-19 pandemic was. And the biggest challenges that we're going to see are rooted in policies and the absence of policies that address the universal right to housing, that address safe housing, harm reduction, and other supports for people experiencing homelessness. We really see another issue is always around resources and resource allocation. And I do very much believe that we do need to take a hard look at our city budgets and the way that our decision makers are allocating a very limited resource. So when you have a budget, it is by definition a very limited resource, and the way that we use that money is going to impact every single person in the city. And I often see that we've had this chronic defunding of our social services over decades that results in these crises. And we fall into this trap where we look at this moment where the crisis is happening or has already happened without looking at the decades of policies that contributed to this, right? So we are looking at issues where there are in large cities, certainly in Toronto, very inflated police budgets. For example, somebody mentioned defunding the police, which is actually a movement that I deeply support. I really do believe that we need to defund in order to improve the way that police can offer services and have the proper people doing the other services, providing the healthcare, providing the housing support, providing the social work. I think that there is a real harm when we see mass amounts of money hoarded in police budgets, because that comes at the expense of community services services, of transportation, of housing, of all of these social determinants that contribute to good health, to safe health. We know that the healthiest and the safest and the most well communities are not the communities that are over-policed, they're the communities that are the most well-resourced and the most privileged. So when we're talking about that, we also have to consider the impact that systemic racism plays in this mental health crisis. Privilege is deeply intertwined with issues of systemic racism, especially anti-Indigenous racism, anti-Black racism. You know, we see this in Toronto alone, where 91% of Indigenous adults are living below the low income cutoff line, right? This is a direct result of systemic policies that our government has put in place. So when people say that these are policy failures, these are actually policy successes. What we need to do is change our policies to see these outcomes change. We definitely need to address that. We need to address solutions based to public health. Unfortunately, I don't know who mentioned this, but apathy is a big issue. Apathy and fear and a lack of understanding. And when there was the COVID-19 pandemic, we were able to, as a community, spring into action for the most part and really understand how to work together, because protecting my neighbor protected me and my family. If I could protect my neighbor from getting an infection, it meant I could protect my mother, my elder, my children. Unfortunately, when we're walking around, to grossly oversimplify this, you can't catch a mental health, or you can't catch addiction from walking past a neighbor that has this. So it's often harder for us to understand that helping that neighbor will still help me. It will help my community. It will help the safety of my family and the general wellness of everyone around us. Healthcare is so much more than just what a physician interaction or an interaction with a primary care provider or a healthcare provider is. We really need to look at healthcare as encompassing every social determinant of health, and really understanding that businesses work together with community members, work together with healthcare providers. We just need to shift our policies and stop considering this as some kind of a systemic failure, and realize that these are systemic successes. These are the outcomes of the policies and the laws and the budgets that we put in place. These are the results of the amounts of money that we ask for, the way that we continuously deprive some organizations of resources and then over-resource other aspects. I think that it's really important to understand this is not something that we can police our way out of. This is not something that we can address without including the voices of Indigenous, Black people experiencing homelessness, and other marginalized people who very often do have solutions. I do not believe that our healthcare system is completely broken. I believe that there are solutions that exist within the communities that have not been listened to. Some of the work and some of the people that I work with through ICHA, through the Indigenous Health Program at ICHA, has proven that we can make wonders work when resources and power and decision-making is put into our hands.
Wow, that's a lot. Just a couple of quick comments. First of all, apologies those of you that had to look at me instead of Suzanne. I don't quite know what's going on, but the tech guys are trying to figure that out. You do not need to look at me, you need to look at her. But we heard you, and I saw you, and we heard you loud and clear. And I'm interested, Suzanne, you talked about public health and you talked about community health. Are they the same thing?
Oh my goodness, I feel like Andrew Bond would be able to give a much clearer, more articulate answer than I can.
Both of you can have a go at it, but you know what I'm getting at, because part of what I'm hearing from all of you is, and this is a very common challenge in urban life. It may in fact be that the best intervention and the best support that can be provided on any number of issues, mental health, economic development, land use, should actually be being done at the community level. But the dilemma is that we're not set up in Canada to fund. The big money is not at the community. And so we're in a situation where it gets bumped up, and then Cam is there saying, Mayor Cam is saying, I need the money. So I sometimes feel like we should try to, if we can, before we talk about how we don't have enough money, can we talk about where most appropriately should we be providing mental health services? So why don't, Suzanne, you take a go at that, and then Andrew, and then others can jump into.
Yeah, I believe that mental health services need to be provided to so the person who's providing the service should be the person that the patient will go to. Right. So that is what we have to have. There has to be access to culturally appropriate care, to culturally safe care, to somebody who is able to provide a service in a way that a person is able to access it. So when we see decades and centuries of exclusion and policies, very harmful colonial policies that have driven Indigenous people and many Black communities from being able to access healthcare structurally, we then need to shift and look at, there's obviously a inertia in the status quo that has created this condition of marginalization that we're seeing. And therefore we need to have actually new solutions. Our existing structures, the way that we're providing care is not working for everyone. So how do we make that work for everyone? We need more representation. We need to have more Indigenous healthcare providers. We need to have community healthcare workers. We need to look through the lens of social medicine. So social medicine is really truly the way in which, for example, Indigenous people have been providing care for each other through this kinship system for centuries, where you have a family of support, where you have people of support, where there is always a pathway to somebody that you trust, and then that person can help you. And for example, a network of what we call aunties. So we just have a network of people here in Toronto at the Call Auntie Network, where we really are just consistent, reliable, present, and available. And you can access us, and we may be the nice auntie, the mean auntie, the difficult auntie, but we will always be reliable. And we'll always
you might be all of those things all at once.
Exactly.
You just described a story though about how during COVID somehow we realized we had to save ourselves, we had to be supportive of the other, and now we seem to have lost that commitment collectively. But I hear what you're suggesting about peer-to-peer support.
Yes.
Provided at the local level with people that are appropriate to be providing it. And I can see Al nodding his head from his own experience. I guess the question, I want to get to the money piece and how we're going to fund it. But Andrew, can you just speak to that? And then we can hear from Superintendent Tran as well, because the police are obviously always a lightning rod about this, about should they be providing any service or not, or do people not want the cops in this space at all? Andrew, and then Al, and then Howard.
Yeah, thanks so much. And thanks, Suzanne, for that initial framing. I really agree that it's really starting from the point of where will people actually meaningfully access care, right? Is that the bottom line is the connection. Nothing happens without a durable connection over time. And then it has to be a connection that actually has the skills and resources to be able to deliver on the outcomes that we're all trying to strive for. And so in terms of the where and the funding, we know now that the vast majority of mental health care outside of some of the most dire emergencies where people have to sometimes be involuntarily brought into hospital, and that is a new lightning rod issue as well that we can come back to at some point along the way here. We know it's quite politicized now about what's involuntary versus not, but where it's truly necessary, outside of that, the vast majority of care can and should happen in the community because of two things. One, that is where we know most people will go for their care. That is where they live, that is where they work, that is where they get care and supports, and that builds up community and neighborhoods. And secondly, it's more cost efficient, substantially more so. And so any cost efficient, wise public policy would take the perspective of what works more effectively, what builds communities better, and what does it more cost efficiently. And so
Andrew, what do we do about the fact that the healthcare traditionally in Canada is funded by provinces?
That's right.
And the dilemma, though, is that you guys are all describing services that are delivered at the hyperlocal by the municipal government or even by NGOs and community groups, and yet the province holds the dough, and then the feds hold the dough that the provinces get. So in that context, and Andrew, you're funded, I'm assuming, by the Ministry of Health, right?
That's correct.
So what do you think and I see a lot of people in the chat saying cities don't have enough money, Toronto's running off the property tax, fair enough. Maybe that's a larger discussion, but in terms of actually getting dough on the ground functioning, what is your experience with that? Should we just be spending more time talking to the provinces about getting money into the hands of people?
Without question, I hope that
Suzanne is shaking your head and you're saying yes. Okay.
So I think we absolutely need more provincial funding to be able to back the kind of supports we're talking about. I'm certainly interested in, Suzanne, please jump in on what you think on that. But I would never say no to that for sure in terms of seeing that transition happen. We know the balance between acute care and community care from the province is substantially imbalanced, and not in ways that actually make sense from driving population health. And so one thing that you'll see in the United States, for example, and I'm going to be risky in talking and looking to the States as an exemplar in the healthcare space for the moment, is to say that the idea of value-based care, which is health policy that is funded on outcomes, not the service delivery units, actually changes the way that everybody tries to start changing the care, even in the private sector. Now,
Mhm.
not to say that we should go that path. That is not what I'm encouraging here in terms of the overall policy approach, but the idea, the health policy idea of investing in outcomes will then drive and incentivize the kinds of things that we're actually talking about, because then it actually is around what actually changes outcomes for people in the most cost efficient way. And that's what we're talking about.
So value-based care is another way of saying outcomes-based care, yes?
That's correct.
Okay, Suzanne, do you want to jump in on that? And then I'm going to go back to Al and then Howard. Go ahead, Suzanne.
Yeah, I would just very quickly say I agree with Andrew. Ontario Health should always continue to fund and fund.
Take
and
the
fund.
money.
Take the money, but there
Right.
is also a lot of money in a city budget. There's a huge amount of money in a city budget, and that the reality is that if you shift around the way that you allocate the resources within this budget, it will improve the health of our community. You know, we have a housing crisis, we have an affordability crisis, we have a public transportation crisis, we have an infrastructure crisis, and we see consistently the only aspect of our budget that keeps, and I'm not trying to, you know, hate on the police, it's constantly this increasing police budget. And again, we cannot police our way out of poverty. We cannot police our way out of systemic racism. We cannot police our way out of homelessness, and we cannot police our way out of the drug crisis. We do not need to, we need to look at a solutions-based approach in the way that we divide a city budget and the way that decisions are made within it, at the municipal level. I think the municipal government has a lot of power in improving the healthcare of a city. And of course, Ontario Health just needs to let us have the funding that we need.
And then you would hold the city accountable. I'm going to go to Al and then Howard and then Cam. I know you're dying to come in on that. So because Suzanne's thrown the gauntlet down and said, get the money into the local hands and then hold them accountable for delivering the service, right? Have I got you right, Suzanne? Did I summarize you pretty well there? Close enough?
Yeah, close enough. We gotta make good decisions.
About how we spend the money we've got. Yeah, okay.
Exactly.
Okay, Al, Howard, Cam, I haven't forgot you, Kyle. Al first.
Sure. I'm involved in several different areas, being vice chair of CAB here in Winnipeg and the reaching.
Explain what CAB is.
Oh, yeah, Community Advisory Board. We are the guardians of the community money that comes to Winnipeg from the federal government for issues of housing and homelessness. Yeah, and I think that that's one of the areas I'm involved in, and in this particular area, I think that perhaps we could, because we do spend money on programming, we do spend money on capital, but I think during the program, maybe there should be a mandate to and have a heavier emphasis on mental health programming, right? And I think that would go a long way. You know,
who would you give that mandate to, Al?
Well, to the entity in Winnipeg, which is End Homelessness Winnipeg.
Oh, I see. So you would charge that, whatever the architecture was created, you would charge that to be accountable. Okay.
And then they could. That's our job, is to perhaps give End Homelessness Winnipeg a direction which way to go. And so we do have several entities in Winnipeg, like Canadian Mental Health Association and Sarah Real, but they just haven't been given a long enough rope or given enough money to really make a difference. You know, I did work for Canadian Mental Health Association for a while, and you know, did such a great job in working with their participants from not only a lived experience lens, but through a mental health lens. And I think it's really important that we change the mandates of some of the reaching home money and the programming to really emphasize on mental health. Sure, we need capital to reduce housing, to reduce homelessness, because you don't reduce homelessness without housing, and that's always an issue. But also, I'm on the Community Advisory Board for the library here in Winnipeg, and we created a space called Community Connections, and in that space we had different service providers throughout the city come in 20 days a month, and actually Saturdays as well.
Wow.
We did have to close it because there was a murder due to mental health issues in our library foyer, and so we did have to close it, and still not open 4 months later. But we're working on that. But you know, in that space, there are crisis workers as well. 3 crisis workers, and we're about to, you know, get funding for more, but funding is always an issue with libraries, and they're really fighting the city on that.
So I'm going to come to you, Howard, and then Cam, and then Kyle. But the thing that's interesting about what Al's describing, and I think what Suzanne was getting at as well, is that community-based services can be provided by a municipal employee. They can also be provided by an NGO, or they can be provided by a kinship group. So I guess that's the question, is how do we make it more possible to have various ways of delivering these services? And maybe it's not going to be the same in every place. Howard, let's hear from you in terms of your perspective is you're part of an institution, you're part of the police force. Do you have a sense in the Vancouver environment how you think the approach to community care could be improved? Should it be more centralized? Should it be more distributed? What's your gut instinct on that?
Yeah, before I do that, can I take some time to just kind of respond to Suzanne's comments about the increasing budgets? I think it's important to see that in context. Yes, our budgets are all increasing, but as a percentage of the overall city budget, it's remained consistent at 20 to 21%. And I know that's the case across sort of the entire country. And so you're seeing the fire department getting similar sort of percentage increases and engineering and stuff. So, these are all pressures from inflation, et cetera, et cetera. And the reality is, the police budget as a percentage of the overall city budget has not increased to the degree that people think they do. And I think I sort of want to echo what the mayor said about, some of the services that are being sort of tagged on at the city level are really not city responsibilities. And I think one of the biggest part, I know from some of the literature that I've looked into that, Canada spends about 79% of our overall health budget on mental health issues, when the impact of mental health on the health budget or on our health system is actually, quite a bit higher, upwards of 15 to 20%, whereas other countries in the world are spending about 12%. And so, when you're talking about 2 to 3%, you're talking about billions of dollars here, right? So I think there needs to be more investment in our mental health system. And I'll just go back to the city level stuff. And, the reality is if you went to a police officer and said, if you never had to go to another mental health call again, and would you reduce your police budget, to do that, everyone would say yes. I mean, mental health related calls are sort of the ones that police officers least like to go to. And we feel like we're being, we've become the de facto response for mental health crisis in the first instance. And the reality in Vancouver is, of the 17 to 20% of calls that we attend annually that have a mental health related factor to them, 20%, 26% of those are actually calls that we get from our health partners in health in the community to provide that support. So we are in this space, not because we want to, but because there is a need for us.
But Howard, this is the dilemma, because librarians might say the same thing. They don't think they signed up for this either. And I suspect business improvement area leads say they didn't sign up for this either. And, that's part of, I think, this larger conversation that we've got to evolve to how do we collectively solve this challenge instead of saying it, look, I didn't sign up, The dilemma. The only person that seems to have signed up is Dr. Andrew Bond. And, how many can there be? So this is, go ahead.
Yeah, we're doing a number of things. I mean, I don't know if folks on the call know from across Canada, but the new mayor and council have made a huge investment into mental health response and addiction response in this city, and a part of that service is called diversion and triaging. So we're kind of piloting a program where we actually embed clinical nursing staff into our operational command center to go through some of these calls, because we know that many of them probably could be diverted to community services and don't require police attendance. So, these kind of PAC teams that you hear about, the peer assisted community treatment teams, and so we're looking at diverting a number of those calls to those community-based teams.
Right. So you're playing more of a kind of center coordinating role. And I've got to say, diversion triage, not the most attractive terms to say about this, and command centers, but the idea of peer assisted community training, I get that. And the idea that you would be a referral agent to be able to then bring in the real supports that Andrew and Suzanne are speaking of. Cam, talk to us, if you can, about what the municipal government perspective is on this. You can see, as is often the case, we all want you to do everything. And I don't quite know how you navigate that. Tell us.
Yeah, so, fair discussion. And I mean, I've always viewed, every budget is not a sacred cow with every department in a city. I mean, we should always be scrutinizing everything and seeing what the outcomes can be in a budget.
Right.
I will just say, though, that, I just came from the Federation of Canadian Municipalities conference that was in Toronto just last week. And the overall theme of that conference was straight up about a new fiscal framework for municipalities where these
Mhm.
conversations have to happen with the upper levels of government.
Mhm.
Because we are now entering, as I said in my opening remarks, we're entering this arena of healthcare. And if that's the arena that we're going to have to play in the absence of the provincial or federal government helping us with this, then fine. At least jurisdictionally tell us that we're now entering that arena, but you're going to have to help us with the resources to do it. And
Mhm.
so,
It is bizarre to think that property taxes should be paying for mental health supports. That's kind of crazy. That
correct.
the math wouldn't work, even if our property taxes aren't assessed as equitably as they should be. It's a weird way to do it, right?
Correct. And I don't think it is as easy to just pick one department and pick on that one department and say, we're going to fund something else out of that. I
Mhm.
think a budget is about values, which I think we should all agree on. And it can come from multiple places to try to achieve those results of the value-driven type of budget cities are trying to manage and balance. And then I want to get to the solution part too, because you
Great.
mentioned that earlier. Is well, what do you think we should do? And so my perspective is it has to be housing focused. When we give people dignity and safety and security for them and themselves or their life belongings that are with them, it changes the perspective of having that ability to have a roof over someone's head, to give that supportive housing to those people that are in need so they can get the actual healthcare requirements that can wrap around them, including community, nonprofits, the neighbor down the street, anybody that can wrap around these people. In Guelph, we had zero sort of supportive housing projects a few years ago. This year alone, we're opening 72 beds. So we've been really, really, really putting our efforts into that. But if we don't give people that dignity of a house, and I think it was Andrew that mentioned this, but it is substantial. As a fiscal conservative, you want to do the housing. You
Right.
save so much money by doing the housing. It saves in all the emergency responses, all of them, police, ambulance, fire, even our own municipal bylaw, etc. It also diverts away from the emergency rooms where all of our emergency rooms are being overrun. It is so much cheaper to actually just put the focus on housing. It's financially the best thing. It's mentally the best thing. It's dignity. And that's where you got to go. And that's what we're trying to do here as best as we possibly can. But my last comment would be that the federal government has been pretty good on the capital side of trying to help with housing. Where the province needs to step up a little bit more, in my view, is on the operating side. So if the bricks and mortar are there, the province has to step up with the oversight and the operational funds. And then the city on our municipal end, we can approve all day long these types of housing projects. And that's where the collaboration can come together to help these people, because that should be our focus.
I just want to thank the chat as usual, never disappointing. Tons of ideas, questions, thoughts in that chat. Thanks, everybody. Keep chatting away. I'm trying to feed them in as best I can. Can we spend the last 10 minutes on this session talking specifically about solutions that you're watching that are working? And Cam's just said housing, or housing first, or what everybody else is suggesting. Let's hear from Kyle, because he is, in fact, he's pioneered a program that I think actually started maybe in Guelph, Kyle, but it's a very tangible Welcoming Streets program. Can you just speak about how that is working and how we've heard you speak about it. I'm interested for you to tell the larger group.
Well, we actually have a few programs within our community that are both here as supports for our business population, as well as supports for our vulnerable populations. One of them is our Welcoming Streets. We haven't actually launched that program yet. It's going through municipal funding at the moment. But we look to have, you know, just as we have outreach for our vulnerable populations, have outreach for our commercial, or our merchants as well. So in fact, it speaks to all this, you know, defund the police, or rather more like a reallocation of funds. So we got our police service to invest with us in putting, and they don't show up in uniform. We would have our own workers that go out, and they're the point of contact for our businesses. So if someone's having a mental episode or an overdose or just needs some help finding a place to go, you call them instead of calling police. You would call them to de-escalate. You would call them for education or empowerment. Because in the scenario we've been left with, and like I said, I get to walk right down the center of all worlds. I work with our police service and I work with our vulnerable populations as well as our outreach. And everybody wants the same thing. Everybody wants people to get the help, the help that they need. They need them to get the services they need. Our police services recognizes that it's not them that's going to deliver this. They need to be there for safety at some time, but it's not necessarily them that's going to deliver this. So we can get police back to policing, doing traditional police work, and deal with their mental health as well. Because one of the things that's never discussed is the mental health of our police service, which is in steady decline as well. And then we don't get the service that we need, we don't get the response that we need, and we don't get acceptable response. Likewise, in our scenario, we know that our vulnerable populations are primarily Black, Brown, Indigenous, racialized people. And, for us to get service, we need to essentially say that we're feeling threatened, which then puts that person in further jeopardy. So what we need to do is remove that entire scenario, take it out and find a way to access someone that can either direct them where they need to go or have the information. Because let's be honest, not all of us have either the gall, the bravery, the education to stand up to some of these things that we have to face on a daily basis. It's not necessarily a comfortable environment.
Yeah. And the point that Suzanne was mentioning is that it's all well and good to provide the support, but if it's not coming from a peer, from someone that the recipient can actually be responsive to, this is sophisticated, thoughtful stuff. And a lot is being expected of people that are engaged in any kind of street-facing, public-facing work, whether you're a librarian or a cop or a firefighter, or you're just a neighbor. It's a lot expected. Right?
And to add to that conversation, one of the things that I would like to see, I'm a typical entrepreneur, efficiency is where I'm at, trying to, keep everything streamlined. And what I would worry about is I think I know we have a general strategy, but we need to pinpoint where we're actually going and what actually is important to these programs to solve first the root cause of the issue. We can't keep band-aiding anymore. And my biggest fear is that we create a siloed industry of poverty and homelessness. I don't want to see our organizations. I'm so grateful for everyone out there doing this fantastic work. Hats off to everyone. But if we have overlapping services, we can throw all the money in the world at them. They're going to start competing for the money, and then we're getting less service in the road. So
I just want to point out that the chat is particularly blowing up, as it tends to do late in the session, and they all want more. We're going to have a longer session. I see that Mayor Carter's here from Oshawa talking about nice to have you on the session, Mayor Carter, talking about the Welcoming Streets program they've had for a few years. So lots of good examples that we probably need to highlight and surface. So please, folks, put more solutions into the chat and we'll broadcast them. And maybe we need to do a deeper dive on this. We've got 5 more minutes, and so I'm going to ask each of you to just highlight briefly one tangible solution that you're seeing that's working. So we've had the Welcoming Streets initiative. Al, you mentioned the 20 days in the library that got shut down because of an unfortunate situation, but it sounds as if that was a really interesting intervention. Superintendent Tran, you've talked about these coordinated services and that you're now working more and more with agencies. Anybody else that has a particular solution they want to highlight that people should look more into? Suzanne and then Andrew, or Andrew and then Suzanne. Go ahead, Andrew and Cam. Okay.
Thanks so much, Mary, and I'll be quick, Suzanne. So the piece I'd like to highlight is that we're working right now in a partnership, and I want to come back to what Howard spoke to around the justice system. So because what we've done is we've left aside from the discussion for the moment, which does happen, the visibility of all those who would be in the downtown cores but are now incarcerated, but that is probably for many of their actual home communities, and they are part, even though they are currently segregated in that community still. And so what we're doing is we're in a partnership right now at Intercity Health with the Ministry of the Attorney General, Sound Times Community Services, which is a municipal group, the city, the Attorney General's office, and ourselves as healthcare providers to operate a justice center with a health-focused approach to our care, to work on both decriminalizing and directing folks who are cycling through the system. We know Mary Hogan just did a piece recently about the crisis in the justice system around mental health. It's the de facto, I think, as Howard shared, in new institutional setting. We can change that by these types of systems, that they do exist in other locations, like in the Bronx, for example, some in
We
South
need to
Central
get-
LA.
I'm going to move you on, Andrew, because I want to get the others in, but we should get Mary Hogan to talk about the Community Justice Center model as it exists for the Center for Court Intervention in Red Hook and other places. You're quite right. And it's co-locating and providing that referral service. And yeah, really great model. Thank you, Andrew. Suzanne, then Cam.
Yeah, to be really fast, I definitely think that a housing first policy, a universal right to housing is absolutely critical. I
Yeah.
really believe that resources and healthcare and services provided by peers is unbelievably important. Community healthcare workers, the model of work that Inner City Health Associates that Angie Bond and myself work under has been truly successful. I believe so deeply in this care. I really do.
It works peer to peer. Okay, Cam.
Yeah, so one of the things I've been really trying to do with our community is to raise awareness about the issue in the community, because so often people think, well, government can solve the issue. So one of the amazing things that we did in Guelph last year was council agreed we only had $500,000 left in our affordable housing, supportive housing reserve, but we had no projects really on the horizon. So we agreed to actually connect with the United Way and the Community Foundation to create a matching donation program for the entire community of Guelph. And we just had an announcement today that that $500,000 got surpassed by the matching of little tiny donations like pizza party things at a business, or large donations, but that $500,000 turned into $1 million to go towards supportive housing projects here in the city of Guelph. And it's just, I think, a testament.
You leveraged.
Yeah, we leveraged 500, turned it into $1 million, but at the same time brought awareness to the people of Guelph, because it can't be solution oriented only by government. It has to have the awareness and everybody involved. And it's not just about, handing out clothing or food, and that's all perfectly fine, but we need resources as well. And the people of Guelph and businesses stepped up. And I just wanted to say that matching program was a pretty cool idea, and it's worked really well.
Great. Howard, Kyle, Al, quick solution.
I think there needs to be acknowledgement of everyone here that mental health and addiction are really interconnected. I know we're talking about mental health only here, but so for me, treatment on demand, harm reduction, we totally believe in it. Safe supply, decrim, all that stuff. But we really need to bring up the other pillars, which is treatment and prevention. So treatment on demand, I think, to deal with sort of the folks that are using our resources the most. So.
All right, Al, then Kyle.
Yeah, 6 words: housing first, housing first, housing first.
Okay.
Yes, that's it.
Yeah, it is interesting, the question you all posed about, we had all this COVID momentum, right? We all had a sense of urgency. There were no excuses. It was like, get her done. And now we're in this post-COVID period, and it feels like we're lapsing back into all the complications and what can't be done. So how do we get back into that? This is a crisis, and how do we address it? Kyle, last word to you. Have you got another solution to throw in?
No, I'm with everyone else. I just want to make sure that if we are putting housing first, then we're putting the supports that make people successful within those housing, at the forefront. Without, if we're just going to get someone in an apartment that's at the other end of town and not near their children or not near their support or not near their job, we might as well leave them on the street, because they're not going to be successful in that environment. We need to make sure that we're holding up people where they need to be. If they have an episode and a window gets broken, that the landlord's not going to throw them out. Someone's there to fix that window and make sure that these people stay housed and don't end up right back where they started.
I think it's so heartening to have you guys on here. Thank you so much for being part of this conversation and for reminding us that we're not powerless, right? We all have some agency to be able to participate in flagging how we can support, how other organizations can support, how do these efforts, all of you are doing the important work of stitching together the urban fabric and connecting with each other. And let's work with the police, and let's work with vendors, and let's work with small business, let's work with healthcare, let's work with the mayor, all the different players, and let's work with people that are experiencing frontline what's happening to them in terms of their own struggles. So thank you for calling that out to all of us and reminding us that we all have a role to play here in trying to support and create a collective, healthy environment for everyone to be able to flourish. And housing first, supportive housing, let's get to the basics. Thanks so much for joining us, everybody, on City Talk. We're doing one in a couple of weeks on mobility and transit, which is another piece of the equation. But this conversation is just the beginning. You really touched on a whole bunch of nerves, and we won't lose track of it. We'll continue it. Andrew, Cam, Al, Suzanne, Howard, Kyle, thanks so much for joining us on City Talk.